And my contact information is here, smurphy@uniteforher.org. Looks like Smurfy. Easy to remember. Please reach out if you have any questions. And also, I put in the chat a link to the PDF of the slides that I'm going to go over. So if you're interested and want to refer back, because I have a lot of content that you don't have to memorize it all or write it all down, you can have that. It's already in the chat, ready to go. So we know that psychological and social factors influence our motility, our ability to eliminate, and our digestive functioning. And there's a little study or a little paper written up in Harvard Health that showed that multiple studies are finding that psychological approaches are helping people who have chronic digestive symptoms, even when those digestive problems have a known physiological cause. The digestive tract also affects emotions, like I was just saying. So often in our support groups and in my one-on-one sessions with clients, we're talking about how people are wanting to stay positive, but sometimes they're not feeling good. And it's really hard to be in a good mood and have a great attitude when you're just not feeling well. So this, again, is this feedback loop. And there's a study in here for those of you who want to nerd out on the research in an online journal, Frontiers, that was outlining the ways that chemo-induced gut-brain axis dysregulation, that feedback between the gut microbiome and the brain and neurological system, are affecting digestion, mood, and neurological symptoms, with some suggestions about how we can address that. So I want to start by sharing with you an exercise. I'm going to unshare my screen in a second and we'll do it together, but I wanted to just show you what's going to happen before it starts happening. So we're going to do the exercise 2 times, one with your fingertips on your collarbone and one with the closed fist. And then the way that we do this is a certain specific way of breathing. So I work with a bunch of people around the country who do different mind-body things. And there was a woman who got really excited. She was giving a workshop and she did this exercise. And it's so simple and quick, but people were finding it really was effective in kind of resetting their nervous system and really eliminating some stuck problems. And so let's give that a try if you're willing. This is definitely, we're doing some body-based tools. And so if you're willing to just give it a shot, see how it feels for you. Cross your hands over your chest and just put 2 fingers under your collarbones. So what we're going to do is take a breath in and out. Then we're going to take the breath halfway in and hold it, all the way in and hold it. Halfway out and hold it, all the way out and hold it, and then in and out. And then we'll do the same thing like this, and I'll walk us through it. But that's just what's going to happen. So fingertips under your collarbones, take a nice breath in and a nice breath out. Now we go halfway in and hold the rest of the way. Halfway out and hold, and all the way out. Fully in and fully out. Now do the same thing, but this time with loose fists so that that middle knuckle is in the same spot right under the collarbone. And here we go. Breathe in and out. Halfway in and hold. All the way in. Halfway out. And all the way out. And then in and out. And then release, and just check in with yourself and notice if you have any kind of physical feeling at all. This is a really a good kind of triage to kind of get your energy back into balance, get out of a fight-flight response, and starting to use as much as we can the relaxation to impact the digestion, and or at least live with the fact that we have either constipation or diarrhea, or as some of my favorite nurse practitioners say, constaria, and that it's an ongoing thing, and it's like whack-a-mole, and as soon as you fix one problem, then you've got the other one, and it's something to live with. And so how do we live with it? Well, let's not be in a fight flight response over it. Let's use these mind body tools. So I have more. You ready for more? I'm going to reshare my screen and
We're ready.
Okay, awesome. And by the way, I'm super proud of my slideshow. So if you like it, just know that I like it too. So that's the instructions. Like I said, the PDF is in the chat. So if you want instructions on how to do it, you can always refer back to that. I want to talk now about the meridians and the meridian points and the emotions that go along with them. This little diagram here shows the major points that we use. For those of you who have heard about EFT tapping, this is probably the most popular way that people are hearing about meridian points. You know about acupuncture and acupressure. There are many, many, many meridian points along each meridian, but these are the popular ones for manual stimulation in order to harness that mind-body healing for emotional distress. I have a chart here that shows what the different issues are that are said to be corresponding to each of those points. So it'll be interesting to know that where the meridian points are for the organs in your digestive tract, and also things like irritability, fear and anxiety, vulnerability, pain, what those points are, so that you can do a little self acupressure if you're interested in doing that. So I'm going to stop sharing again, and we'll just go through some of this data. The meridian points that I think would be particularly helpful to be working on when you're dealing with digestive issues, the stomach meridian, there's a point right here under your eye. So if it's more nausea related, you could try giving yourself just a little massage or tapping or some stimulation, thinking about moving the flow of energy along your stomach meridian, and that might help release the flow of energy and relieve some of those stomach upsets. The large intestine meridian is at the corner of your index fingernail. And so you would just give it a little rub. You know, sometimes reflexology, there are points on the feet too that we can stimulate to get a different physiological result. So cramping, lower intestinal cramping could be maybe alleviated with a little bit of this manual stimulation in the large intestine. The small intestine point is over here on the side of the hand. So right there, give it a little massage, little acupressure, a little self-soothing with that. And then a really good point to know is this one on the back of the hand that's between the bones that lead up to pinky and ring finger. This is a treatment point on the triple warmer meridian, and giving some stimulation and massage here can reduce pain and depression and a whole bunch of other emotions. So you could do a little circuit of, let me tap or massage under my eye, on my index finger, nail bed, on the side of the hand, and on the back of the hand, and just slowing down to kind of bring our physiology under control while also manipulating these points and potentially unblocking some stuck energy that might help us to feel better. And then another interesting thing to know about is the anxiety point. So if you're feeling like, I'm afraid to leave the house, and it becomes a vicious cycle and we get trapped, and it's no longer logical, it's just pure visceral emotion, that anxiety could be released by massaging this point right under your collarbones, or these points right under your collarbones, the kidney 27 points, very important about anxiety. And so a little self-soothing, a little self-applied acupressure, just massaging these points could be a super helpful thing to do. Now, those are just some practical points about using a little self-applied acupressure. I've got a lot of experience using EFT tapping in particular, and that has a lineage coming from Eastern thought and very well validated in terms of Western psychology, a good body of research showing that that particular modality is really helpful. I just took it a step deeper for our talk today to get into the nitty-gritty of what points relate to what meridians, and then also a little bit about what emotions are involved in that. So if you're interested in those things, again, the chart is in that slide deck that I put in the chat, and we can talk about that some more, but just a little taster of some things that you could do from an acupressure assisted therapy point of view. It's really important for us to remember that that mind-body connection is something that's continually affecting us. The body affecting our mind and feelings and thoughts, our thoughts, feelings, and emotions affecting the body in this continuous feedback loop. And sometimes there can be a vicious downward spiral. And again, we want to find the levers of power where we can and put the brakes on that, and instead put ourselves into a virtuous upward spiral where we're accessing better feelings, more calm. The more calm we are, then the more calm our body will be. And then with the things that we're learning from Erin about nutritional interventions to help break the cycle, applying things that we're talking about here, mental, emotional ways to break the cycle, we could really be creating better.
Why do we always stay away from, why do we always stay away?
So.
Erin, Sarah, I love those points, by the way. It just feels like I have some tools to think about, when those things creep up, so you can remember them. They're pretty quick and easy, the ones that you gave us to do the back of the hand, the side of the hand. I know you put it in the chat at 5:05. If people came in later, they won't see it in their chat. Would you please put it in again for us, Sarah?
Yes, absolutely.
Oh, great. And then we'll have these for the recording. We'll put like the PDF files with that, so they're coupled, but I just want to make sure no one missed it, because that was a very nice slide. Thank you.
It was a really good slide. Thank you, Sarah.
Good, absolutely. I'm going to reshare my screen and move on to show you some other stuff that I wanted to touch on today. So I'm so glad that you enjoyed that. So I want to talk about, well, actually, let me unshare again so that I could talk a little bit more and then show you what we're going to talk about. So we have in Unite for Her, starting tomorrow, we're going to do a weekly EFT tapping series. That's a 6-week series. So if you haven't heard of EFT tapping, listen up, I'll tell you. If you have heard about EFT tapping, this will be a little refresher. There's a Eastern influenced acupressure assisted exposure therapy that's getting really great results, really good growing body of literature showing how important this is to handle a bunch of mental, emotional stuff. And we started doing some EFT groups in Unite for Her about 6 months ago. And so far, the people who have gone through the program, I asked people at the end, there's some data that they were filling out kind of more officially, but the casual conversations were at the end of every session, how do you feel now compared to when we started? Always better. I always ask people to rate their emotion on a 10 scale. And it's so interesting to see within 1 hour session, people going from a 8, 9, 10 of intensity down to a 1, 2, 3 of intensity. And at the end of the 6-week series, people were, oh, thank you, Marianne, saying in the chat that she took the program and enjoyed it. At the end of the whole 6 weeks, people were saying that they definitely felt better at the end of 6 weeks than they had felt at the beginning, at the outset, just looking back. So I'm going to share with you how to do EFT, but I wanted to give that little preface. It's something that we will be continuing to offer as far as we know, as long as there's still demand for it and people are still getting great results. And that seems to be the case. So if you're interested, you can definitely hit me up, send me an email, we'll add you to the list. And also look for it in the new year if this session doesn't work for you. And it can be done asynchronously. Every session is recorded, but I'm not trying to just advertise programming. And I know that not everybody here is a current passport holder, and I don't want to leave you out. So let me show you how to do this really powerful technique. So you start by assessing your intensity on a 10 scale. And it could be the cramps that I'm having. The guy who first taught me EFT had come to learn about it because he had a skin problem that was affecting his eyes, and he was having an acute flare up, and somebody showed him how to do EFT, and he was amazed by how much better he felt. And I keep looking at the literature, and particularly preparing for our talk today, what's happening with people who have digestive problems and how people are using it to feel better, even when there's a known physiological cause. After doing just a short bout of tapping, a lot of symptoms were really reduced. So you start by keying into your symptom, rate it on a 10 scale. And then we start by tapping that small intestine point that I was just telling you about. We'll tap there while you're saying the problem and an affirmation, which usually is, I deeply and completely love and accept myself, but it could also be, I know that I'll feel better, or I know that I can get through this, or anything like that. And we'll go through all of it together, but I'm just going to tell you what we're going to do, and then we'll do it. After that, no more loving yourself or having an affirmation. Just focus on the problem. Tap the top of your head, the inside corner of your eyebrows by the bridge of your nose, outside of your eye, so close that it almost makes your eyeballs wiggle, not way out on the temple. And then right under your eye on the, shall we call it a dark circle, that area, under your nose, under your lip, and that little line that we have above our chins, right under your collarbones, and right under your arms at the bra area. And so do a round of tapping with that and notice how different you might feel afterwards. And this is, again, a tool in the toolbox of mind-body techniques that can really help put the brakes on some of our distress, get us out of fight, flight, freeze. And as we exit the fight, flight, freeze response, a lot of physiology will calm down. There have been plenty of studies that show that this works for pain and other physical complaints. And then again, that can help us with our mood. So do you guys want to spend a couple minutes going through that? I have other things that we can do and talk about, but are you willing to do some tapping just to give it a try? Okay, let's give it a try. So feel into yourself and feel in this very moment, how are you feeling right now? What's top of mind? Are you feeling a little nauseous? Are you dealing with potty problems? Are you anxious about them, even though they're not present right now? Or is there something else that's really top of mind for you? Tune into that, whatever it is, and rate it on a 10 scale. And now we'll start by tapping on the side of your hand and say, even though I feel whatever it is that you're feeling, I deeply and completely love and accept myself. And we'll do that one more time. Even though I feel whatever it is, I deeply and completely love and accept myself. Now we go to the top of the head and tap, but I feel. And remember that level on a 10 scale. Right inside of your eyebrows, I feel whatever that is. Outside of your eyes, I feel that whatever it is. And under your eyes, I feel that. And remember your number on a 10 scale. Right under your nose, I feel. Fill in your feeling. Under your mouth, that feeling. Right under your collarbones, my feeling. and under your arms, that feeling. We'll do one more round, take it from the top. So remember the 10 scale, what that physical or emotional feeling is, eyebrow corners, that feeling that you're having outside of your eyes, that feeling that you're having underneath your eyes, that feeling under your nose, that feeling under your mouth, that feeling under your collarbones again, that feeling, and remembering where it's been on a 10 scale, how intense it is, and then under your arms, that feeling. And then just pause and take a nice breath. And just notice, is there any shift in your intensity on that issue that you've been experiencing? So that was so fast. And if you had any kind of reduction in intensity, I'm sure you can imagine that with more practice would come more reduction in intensity. And of all the tools that we could talk about, this is the one that I just want to come back to because it's a self-help tool. It's evidence-based. You can do it. You can learn how to do it and do it anytime. I have always found that it's more effective for me when I do it with somebody than when I do it by myself. But it's effective when I do it by myself also. So, and I'm not even going to reshare my screen. It's just a repeat of how to do what we just went through with a little bit more details. So in closing, I would say that I'm happy to hear from you, answer any questions that you have. I know that there's somebody that I want to reach out to from seeing the chat go by, that we know for sure that there's a highway between the gut and the brain. We know for sure that when you're in cancer treatment, the medicines that we're taking are affecting our gut microbiome. We're doing things from a physical point of view to rebuild and repair that gut microbiome. And that's what Erin is so skillfully sharing with us. One of the many things that we can be doing from the physical side. Awesome. And we're also looking at how the gut is affecting the mind. So if you're more distressed than you think you should be, maybe it's because your gut's out of whack. And so be kind and patient with yourself and work on repairing from the physical level. And then the reverse is true as well. So if we're in a constant fight flight response, if the gut problems are starting to take over our lives, we need skills and tools to deal with that. We need to be able to soothe ourselves so that we're not in a heightened state, because when we're in that heightened state of arousal, it's going to affect our gut even worse than everything else that's going on. We want to find the levers of power where we can and give ourselves some exit so that instead of being in that downward spiral, we're in that virtuous upward spiral. We know also for sure that when we're in distress, we've got to involve our body. It's very impossible to think our way out of a fight flight response. This is why breathing, for example, is so touted. When we slow down our breathing, that starts to slow everything down, including our high beta anxiety brainwave frequencies. It'll calm us down. Things that bring you back into your body, back into the here and now, so important. Come out of that anxiety spiral, come out of that distress, and come back into this very moment. And what I'm doing right now as I'm talking is one of the easiest, most effective, simplest ways to come back. And that's just to give yourself a little light touch. Hand to opposite arm, dragging your hands down towards your elbows. It's a little bit like a hug. It's giving your body this physiological feedback that's saying, slow down, come down out of that anxiety spiral, come back into your body, come back into this right here, right now. Even if you're on the toilet and feeling distressed, you can still soothe yourself. Calm down. I'm okay. It's uncomfortable, but I'm still me. It sucks, but I'm okay. Kind of reframing that self-talk to be soothing and gentle with yourself. So a couple more tools for your mind body toolkit, and I will stop talking. Turn it
Thank
back
you,
to
Sarah.
the group or to Erin. Yes, absolutely.
Yeah, Erin, that was great. Sarah, that was great. I feel like you gave us like 4 different tools, one being the breathing, exercises. And again, we can see this all in your PowerPoint that we'll have. The second one being the acupressure areas, the third being the tapping, and then the fourth, just like that hugging and that, soft movement. So tools are powerful. I know you're going to get back to Pat in the chat. She said that she's had a couple teachers for tapping and didn't have the success. So maybe you can guide through maybe what she went through and personally chat with her. That would be great. And thank you. Thanks so much, Sarah.
Thank you.
Yeah. All right. We're going to pop over to Erin. Erin, I am going to pop you up next. We'll replace that spotlight. All right. You are up, my friend.
Yeah, that was really, let me take these off. That was wonderful. I am very happy Sarah not only talked about the path between our brain and our gut, but also that reverse, right? Our gut and our brain, because we are learning little by little the effect that various bacteria strains that live in our gut, how they affect our mental health, right? How they play particular role in the amount of depression, the amount of anxiety. And so know that that is a two-way street. I'm really glad that she brought that up, and I'll touch on that as well during my presentation. So just to share my screen, let me do that. We'll get into a little bit of the nutrition talk. Bear with me one second. And a lot of this, as I'm doing this, so a lot of this, I will ask, I hope you can see that. I will ask, there will be a couple points where I'm going to ask for some sharing, because what I have learned in my time, not only with Unite for Her, but just in working with patients in the hospital setting, is that you often figure out what works for you. And that sharing conversation of, I tried this, this is what worked, or this didn't work. So there will be points that I will just ask, what did work for you? Because I think these are the moments where we can learn from one another, and we may get a tip and say, oh, I didn't know about that. I didn't try that, because we know how stressful GI upset can be in general. So let's dive into the food portion of it. And as I said, when we think of causes of GI upset in general, and we're going to talk about lower GI, constipation, diarrhea, a combination of two. I can't remember the term Sarah used, but I love that. What causes GI upset for one person may not have the same effect on someone else. And I think it's really important to start off with that, because a lot of times with any type of health diagnosis, especially if a cancer diagnosis, many of us know others that may have a certain treatment. And so we hear what their experience was like, right? And so we start to anticipate, I'm going to feel this way. I've heard this is going to happen, right? And now we're starting to feel that stress and anxiety. And that is not a guarantee that you will react the same way, because every person is different. So I always like to say, know that just because we talk about certain things doesn't mean it's going to happen to you. With that being said, just because your physician says, we don't usually hear that type of side effect with this medication, but you're saying, but this is how I'm feeling, doesn't mean that it can't possibly be true. So I always like to point that out, because you know your body best, right? You are the most knowledgeable. So that takes precedence. So let's talk first about the usual suspects. When we talk about medications, treatments, things that me as a dietitian, our team as culinary dietitians, when we are chatting with our participants, and I hear these medications, when I say, tell me about where you are with your treatment, with your diagnosis, and I get a little bit of background, and I hear any of these medications, my signals go off, right? Xylota, adriamycin, Doxil, Taxotere, Perjeta, Herceptin, Erbitux, Taxol, Verzenio, Enhertu, right? Any of these names, and I start to say, Erin, let's ask about GI health. Make sure that we talk about how are you feeling? What are your side effects like? Are you having some GI upset? Are you finding a rhythm? Certain days that you're feeling one way, but then it gets better. So know that some of these medications we know can be causing GI distress. And these are sort of those red flags. This is not an all-inclusive list. And again, you may see some of these, there may be, and I'm sure participants here that maybe have been on Herceptin for 8, 9, 10 months, right? Maybe you're approaching your 1-year mark and you might say, oh, I'm fine. I have, maybe you feel a little fatigue, but you're not experiencing. So it's not a guarantee, but these are the things that jump out at us that say, oh, we might start to have some GI distress. So let's make sure we talk about that. So know that, and Sue said this earlier when we were sort of connecting, I think seeing these medications may make you feel, okay, it's not just me. There are others that may also be experiencing this, and that's where that sharing is so important. So first, we're going to start with constipation, right? We're going to start with the C, okay? So just some basic overview of what constipation is. I'm sure most of us know, but I'd just like to do a quick review. Remember, we're not having regular bowel movements. We're not moving. Several days have gone by. We're not having a normal bowel regimen. And, our nutrition team, we know, and for those of us that have connected with you, as much as we're talking about food, we're also talking about your bathroom habits because one is connected to the other, right? Because it is important for us to know. Are you experiencing, just not normal bowel movements? Is it smaller than normal? Consistency is different. Are you having a stomach ache or cramping that just isn't getting better? Are you more distended or bloated or gassy than normal? That abdominal distension, that enlarged belly, all of which are side effects or symptoms of constipation. That last one, you may not put 2 and 2 together, nausea, vomiting. I know when I'm chatting during our conversations, if I hear someone say, I'm feeling really nauseous, usually one of my next questions is, are you constipated? Because think about it. If things are not moving forward and you are getting backed up, everything is getting backed up, right? You might feel more reflux. You don't have an appetite to eat. You are feeling that nausea. So absolutely, if you are really constipated, you may very well be nauseous. When to call your physician, because it is really important. Sometimes we might say, oh, it's fine, I'll be fine, but there are times when you really want to make sure you are in touch with your medical team if you haven't had a bowel movement in 3 days or more. Absolutely. I am an over communicator. I think making sure that your medical team is aware of what's going on is really important. If you are seeing blood in your stool or on the tissue, definitely let them know. If you are experiencing unusual rectal pain, something that just is not normal, nothing you've experienced, or even if it is normal, again, share that with your team. If you have had, and we'll talk about other reasons of why a person may have constipation, opioids is notorious for it. But if you've been prescribed a laxative, right, we've gotten to the point where we need a little bit more than just food and some lifestyle dietary changes. And you have taken a prescribed laxative, your physician is aware of it, and nothing has happened in a day, also a reason to go back and just let your team know. Again, a lot of nausea, vomiting, abdominal cramping, things that are not getting better, all of which I say make sure your team knows. So first, we're going to start with nutrition interventions, what we can do at home. I think many of us may not realize the importance of a bowel regimen. And I put this at the top of the list because it is very, very important. Getting our body on a schedule can be one of those tools, like Sarah talked about, sort of the different techniques we can use, when we're talking about our relationship with our stress, anxiety in our gut. But getting ourselves on an actual regimen, a schedule, is also very important because your body will react to regularly going, right? How many of us have gone on vacation and everything has gone awry, right? We're totally off our schedule. We're totally off our regimen. So starting a regimen and getting into a pattern is step one to trying to help your constipation. So that means having a normal morning routine. It's why many people, when we get up in the morning, we get up, we make coffee, we go take a shower, we have time, and then we have our coffee and our breakfast, we go to the bathroom. Yes, coffee has a laxative effect. It is a stimulant, but it's also part of a routine. And your gut knows, okay, I get up and I shower and I have coffee and I eat, and then I go to the bathroom. And so that regularity is important. So putting that into play is step one of what we can do to try to help that constipation from a food perspective. Step two, let's talk about fiber. So I put our goals for men and women for what the American Heart Association recommends for grams of fiber per day, 25 grams for women, 38 grams for men. I think, frankly, any increase in fiber for most of us across the board is a benefit. So don't get deterred if you're doing a little bit of math and your numbers are maybe a little bit lower. Anywhere we can up some fiber is a good thing. Where do we get fiber from? We get fiber from our plants. So any kind of plant food that you can add in is a good thing. I want to call out insoluble fiber. So soluble fiber is the type of fiber that pulls water in, right? And so we'll talk about other forms of sort of what helps pull water in. Insoluble fiber is kind of like that roughage that helps move things through. Bran, flaxseed, wheat germ, inulin, which is a type of fiber that's found in things like potatoes, sweet potatoes, onions, garlic, Jerusalem artichokes, lentils, chickpeas. So upping our insoluble fiber is a good way to help get our GI tract moving. Now, if our constipation is the result of a medication, in particular opioids, which are notoriously constipating, but we understand, especially when we're working with a pain management team, there may be an appropriate role. A fiber supplement alone may not be enough. And it's often the setting where we may want to look into adding in a pharmacological method to help with that. We'll talk about that in a moment, but just know that sometimes it's just not enough. Hydration, big part of constipation, right? In order to keep our bowels moving in general, we need to make sure that we are getting adequate fluids. 64 to 80 ounces per day at least is a good goal. 6 to 8 cups generally, or 8 to 10 cups, I should say. When we talk about fluids, we're talking about all kinds of fluids, right? I'm making that broth out in my kitchen, which we'll get back to in just a little bit. That counts as fluid. It's not just water. So think teas, think fluids that we're also getting from our fruits and our vegetables, think soups and stews, not just plain broths. So all of these things encompass our fluids per day. I mentioned early on in this segment having warm beverages, especially in the morning, because those warm beverages help act a little bit of have a stimulating effect for our GI tract. So again, we often have coffee, tea in the morning, part of a morning routine, helps for a number of benefits. Stimulant, it's warm, so that's got a natural stimulant effect. It's part of that bowel regimen. So many good things. I mentioned prune juice. So if any of us have connected on the phone, I always refer back to my days in the hospital, and tried and true, let's try some prune juice. And our oncology nurses that I worked so closely with always swore by warming a little bit of prune juice for their patients that had issues with constipation. It's not always an absolute, but I always say it definitely works enough that it's worth giving it a try. So a little bit of prune juice. You can also try things like other nectars, apple, peach, pear nectars. They may be beneficial as well because of the fiber. And in particular, prune juice is very high in sorbitol. Sorbitol is a sugar alcohol. I will touch on them a little bit more when we talk about diarrhea, but high amounts of sorbitol, sugar alcohols, actually have a laxative effect. So they can actually be a stimulant naturally. So give it a go, try some prune juice. And then probiotics, right? So we're trying to help establish healthy gut bacteria, and always starting with food first. So naturally fermented foods to get that healthy dose of probiotics. So we're thinking yogurt with live active cultures, Other fermented dairy products, kimchi, fermented vegetables, again, looking for that live active culture. I usually say it's a nice daily dose. If you can get a forkful, a spoonful in, it's always a wonderful addition. You don't need any large quantities, but it's a great natural addition to get those healthy bacteria in hopes that it will support your GI tract. Okay, so let's talk a little bit about pharmacology. I don't want to go in too much, but I'm just calling these things out because know that sometimes, as much as we want to help things like constipation naturally, depending on, especially in the world of having pain medication, we need a little bit more. So your physician or your team may talk to you about some of these things. Colace, a stool softener, does not have a laxative effect. It literally softens the stool. Osmotic laxatives, so they pull water in. Miralax is the most common, but so is milk of magnesia. So it helps stimulate moving your stool forward. A lot of times pain management teams, if you are working with them and they know that you are going to have an opioid as part of your pain regimen, will often say, we also want you to work in a little bit of an osmotic laxative with a stool softener to help prevent that constipation. It's something that I'm familiar with on the clinical side. Again, not always, but that may be a regimen that you're familiar with. We've got other stimulant laxatives, Dulcolax, Senecot, X-Lax. So again, these other things that your medical team may suggest if you need a little bit more additional assistance. And then we've got opioid antagonists, Relistor, just some other stronger prescription items that you may get from your physician. I would not recommend starting any of these first. Number two, without talking to your physician. So always starting with food first, always starting with hydration, implementing that bowel regimen. And then if you feel like you're having more of an issue, you need to go back and talk to your team. You've got other options, but please don't start this without talking to them first. Let's talk a little bit about herbals, because there are some supplements and herbals that have been shown to have some assistance with constipation. So probiotics, Sarah talked a little bit about how medications in general, these strong medications, whether it is an active chemo regimen, whether it's a longer term medication, can affect just our balance of bacteria in our gut. So maybe taking an oral probiotic can be beneficial. The problem with taking an oral probiotic is we don't have enough research behind particular strains of bacteria that we know are absolutely tried and true effective. So talk to your team about whether they think that's appropriate. If it's something that you're interested in, I usually say starting with an adult, either female or women's or men's probiotic, a good reputable brand that you can get in the refrigerated section. You don't have to go crazy high with doses. We don't need the super million, ultra, mega. Start with just an adult probiotic and see what happens. But again, always making sure your team is aware. Slippery elm is another supplement that comes up sometimes in conversation. There was one small clinical trial. It is part of a tree bark. If you have ever heard of the Essiac tea, slippery elm is one of the ingredients in the Essiac tea, but it is a North American tree bark. There was one small study that showed that slippery elm supplement has been effective for IBS-C. But again, we really need some more data to show its true effectiveness, but there is some good initial data. Aloe juice, high doses of aloe will cause constipation. So that may be something, if you make smoothies in the morning, you want to add some aloe juice to it, that may be effective. And then finally, this last herbal, Cascara sagrada. There is one, it's also part of a tree bark, a North American tree bark. The main ingredient, it's what's called cascaricides. I think I'm saying that correctly, but that has been shown to have a large intestine laxative effect. So those are some herbals you could look into. The Mount Sinai About Herbs website has wonderful information about slippery elm and the Cascara sagrada supplement. I always recommend doing your due diligence, talking with your team before starting any herbals or supplements, but that may be a road that you could try if you're dealing with constipation. So we are We are going to run a little bit over today, but I am just very curious. I'm actually going to cruise through this and we'll leave some time at the end for sharing because like I said, what I have learned most often is that you know best, and there may be tools and tricks that have worked for you that you want to share with others, and we would love to hear that. So let me jump right into diarrhea, and then once we're finishing up, we'll do some sharing at the end. So diarrhea is tough. It is tough. So it's in that increase. Technically, we might be looking at 3 or more bowel movements a day, probably an increase in it being more liquid versus solid is what we're constituting diarrhea. If it is unaddressed, if it is not improved, there is as you can tell, a laundry list of things that can result because of ongoing diarrhea. Obviously, dehydration, electrolyte imbalances. We are losing things like magnesium, potassium, sodium, which can have their own effect. Unintentional weight loss because we are not absorbing some of our macronutrients. Overall fatigue, diarrhea, dehydration, incredibly fatiguing. Nutrient insufficiency and deficiency. So again, malabsorption that's happening as a result of everything moving through too quickly. Malnutrition and skin irritation, right? We're sitting on the bathroom, we're wiping all the time, and now we're just having pain and irritation, so uncomfortable in general. So let's talk a little bit about nutrition interventions that we can try. I want to say, not all of this will work for all of us, but these are worth calling out and maybe are things that you have not thought about if diarrhea is something that you are dealing with. Small, frequent meals and adjusting our cooking methods. So small, frequent meals. So often if a person is having a lot of diarrhea, I will say, let go of the idea that you have to sit down and have a big formal meal when you have your meals, because a large quantity of food that sits in your belly can have that effect of just moving through all at once. But often what's better tolerated is smaller amounts more frequently. So even if it's something as little as a 1/4 cup or a 1/2 cup serving as a side at a time, have that little bit, come back in an hour or two, have a little bit more, right? So smaller meals throughout your day, absolutely fine. It also has been shown that just because you're not sitting down and having a formal meal, those small meals are just as good in terms of getting in all of the nutrients and calorie energies that you need at the end of the day, okay? Cooking methods. So when we were talking about constipation, we were talking about that insoluble fiber, that roughage. So when we're having a lot of diarrhea, those are probably the things that we don't want to lean into because they can be promoting of diarrhea, right? So when we talk of things like our raw fruits and vegetables, which are containing of insoluble fiber and that roughage, cooking methods can be our friend. It's really having to do with that fiber. And when we cook our vegetables, we are softening their fiber. We are making it more easily digestible. So, as much as I would love for you to enjoy that summer salad and those things growing in your garden, it may not be the right thing for you. Let's try grilling. Let's try roasting. Let's try super stew. Let's try in a smoothie. Let's try in a pureed soup, right? So that softening, that breaking down that's initially happening may assist your GI tract and not be so much of an irritant, okay? So think about cooking methods. Hydration is, again, a big part because you think with diarrhea, there's a lot of fluid that we're losing, more than you might think. So we're going back to that normal 64 to 80 ounces a day. For every loose bowel movement that you are having, this is a lofty goal, so I don't want you to get deterred, but we want to 8 ounces per loose bowel movement, or just upping your ounces in general, okay, because of how much we lose at a given time. If you have a lot of diarrhea, a lot of fluids, you may want to consider electrolyte replacement foods and fluids. So remember, sodium, potassium, especially magnesium, we lose in our stool. So magnesium tends to be the key. It's also why milk of magnesia is so effective for constipation, right? Because that high dose magnesium has that diarrhea effect. So, and we lose magnesium in our stool. let's talk about fiber. So you might be thinking, oh, low fat, low fiber, low lactose. The reason for that is low fat because things that are high in fat also cause diarrhea. So a little fat is okay. Of course, we need fat in our diet. I'm talking about things that are really heavy that sit in our belly. Think fried, think creamed, think red meats, high in saturated fat, that kind of stuff. So you want to look for leaner foods, a little bit of a healthier profile, and not those really heavy fatty foods. I'm just going to change my view. Low in soluble fiber. So remember constipation, we talked about how effective insoluble fiber is. We kind of want to move away from that. We're not trying to aggravate that. And then low lactose. Low lactose because even if a person is perfectly fine with digesting lactose, dairy, not usually an issue. Whenever you have that irritation that is happening on the lining of your GI tract, sometimes we're just a little bit more sensitive to certain things, and lactose tends to be one of them. So I usually say during that time that you're having some GI distress, you're having that diarrhea, maybe that's a good time to send those lactose foods aside. Know that you can come back to them later, or maybe just choosing lactose free. And you can try any sort of combination of those things. Now we're going to up that soluble fiber, right? We're going to try to pull water in. We're going to try to bring it together. So we're talking about things that are like thickeners, right? Pectin, applesauce, bananas, the brat diet, right? Pulls water in. So that can help with slowing down or kind of, bringing a little bit of solidity to our bowel movements. Not to say that it will absolutely work, but definitely increasing some of those soluble fiber foods. Also psyllium, which is a soluble fiber. So if you want to add a little bit of Metamucil, Citracel, that ups that soluble fiber as well. Now, one of the things that you also may be thinking about is if your GI distress, particularly your diarrhea, is also causing some gas. Think of those things that tend to be gas forming, right? So cruciferous vegetables, sometimes our beans, we may want to pull back from having them. And again, as much as we love our plants and we are a plant forward group here, there's a time for everything, and this may not be it. So cruciferous veggies, legumes, avoiding straws and chewing gum because we tend to suck in air. When we're chewing our gum, our mouth is open, we can take in more air. Using straws, we can take in more air. So we're trying to really limit that abdominal distension and that discomfort. So that's why I mentioned that there. And then those natural stimulants, right? Caffeine, alcohol, spicy foods, things that can be an irritant or a stimulant. We want to limit those for right now. Let's go back to the sugar alcohols, right? So I mentioned prune juice is really high in sorbitol, and which helps for constipation, but not so good for the diarrhea side of things. So sugar alcohols tend to show up in our sugar-free and our diabetic foods, candies, beverages, that kind of thing. Anything with an OL at the end is a sugar alcohol: sorbitol, xylitol, mannitol. So you want to avoid those because of that stimulating effect. And then trying to establish healthy bacteria. Little bit of research looking at these couple strains of bacteria may be helpful with diarrhea in particular. Again, probiotics are a world that we need way more research on, but we're starting to see, especially the lactobacillus strain, can be effective. So that might be something to think about if you're looking and your physician is okay with you starting an oral probiotic. You might want to see if it contains those strains. Oops, let me continue on. Okay, so quick pharmacology, will not spend much time on this. But again, sort of things that required, you try the food, getting the beverages in, looking at the different fiber types still not working. Again, your physician might say we might need something like an Imodium or Lamodal. Tincture of opium is something I have only ever seen in a hospital setting in a very, very severe case of uncontrolled diarrhea, not something that is pulled at regularly, but I just threw that in there because it is an option that comes up. Things like Pepto-Bismol, kaopeptate, things that are over the counter may be helpful. And then if diarrhea is the result of a lot of fat or fat malabsorption, your physician may say, let's try some Questran. Okay. I will wrap up. We'll get to the work for you. But again, sort of coming back to this initial idea, we've talked about a lot of different things that you can do to try to manage, whether you're feeling constipation, diarrhea, combination of the two. What works for one may not work for all. But I have found that among our community, sharing is caring. And so this is where I want to just give a little bit of time. I'm going to stop sharing my screen. For anyone that wants to share what has worked for you, because I know that even in our participants, I'm thinking of some examples with the Enhertu medication. Constipation is brutal with that. We know that. Just bringing participants together on what's worked and shared to give others ideas. If anyone has any tips or suggestions that they want to put in the chat, if you want to raise your hand and share with others, I think we can take a few moments to just do a little bit of sharing of valuable tips, because we can all learn from one another. So if anyone has any ideas or thoughts that you want to put into the chat, or you want to come off of mute, we would love to hear them.
Yeah, I agree, Erin. I know that you hear so many successful stories too, and that, that can be so valuable when people get into a routine and they know what works for them, and they share it. So one question we did have in the chat, and it was just a difference while the group is thinking about some things that might have worked for them or what they wanted to, share.
Yeah.
We had a question about, is there a difference between aloe juice and aloe water? And I believe aloe juice or aloe water is watered down aloe juice, but I wanted to ask you that. And also, tell us a little bit about the taste. Is that taste somehow, it's unpleasant, aloe juice usually? And does aloe water just have,
It had, yeah. So aloe water is watered down with the aloe. So you would need a much higher concentration of it. So, right. So if you had aloe juice, adding it to something like a smoothie, right, could be an effective way to get some of that and make it more malleable.
Great.
Oh,
Thanks.
I love that. Yep, absolutely. And one thing, and so something, as we're kind of sharing, I'm loving what I'm seeing, the small frequent meals, right? So like, Mary, I love that you brought that up, because even small adjustments like that, is applesauce helped me for a while. Okay. And Catherine, I'm glad you brought that up, because what also happens is you feel like you got a grasp on something, and then all of a sudden it's not working anymore, right? Or like, you're like, Monday, I was doing great. Monday, Tuesday, I was doing great. But Wednesday, my world is upside down. Number one, no, that's normal. It's not because you are doing anything wrong. There is so much trial and error that goes with this, which is frustrating enough, but I always say, hang in there, right? Give it a try. If it didn't work for you on a Wednesday, try it again on Thursday and see what happens. But know that it is not the result of you doing something wrong or incorrect. It is the nature of the beast. It's all different foods. That's right. Applesauce helps with acid reflux. I love that. I love that. Get up and move. Phyllis, I'm glad. And you know what? I'm sorry I was neglectful to mention that. But yes, especially with constipation, getting up and moving, right? That natural movement of our GI tract is good and stimulating. So absolutely, getting up and moving, walking, doing some gentle stretching. Maybe you're walking around as you're doing those tapping techniques that Sarah taught us about as well, as long as we're safely doing that and not tripping over things, right? But absolutely, yep.
I saw here figs too. I had one said that they were actually using fresh figs, and that seemed to be helping them.
Yep.
Mm-hmm.
Yeah, Banatrol. Yes, I would use Banatrol in the hospital, Marianne. So I'm glad you mentioned that. I don't, I'm not sure if you can regularly get it outside. I'm sure it's probably something you can get on Amazon. Yeah, but definitely the active ingredient that you often find in bananas, Banatrol, is a supplement. Yeah, that's great.
Erin, there is one in here too. That the chat is active, so I just want to make sure you're not missing any.
I love it.
One, Adrienne was just saying she's on Verzenio, and it said that there was a drink mix called Gut Feeling that she takes in the morning, and it really seems to help her. Have you heard of that, Erin?
I have not, but I will write it down and look into it, because
I'd love for us to look into that. So she did share on Amazon, I believe she had said that it was like, I gotta go back.
That's okay.
Hi, I can talk if I'm allowed to talk.
Yeah, do it, Adrian. Go for it. Thank you.
My sister recommended it for me. It's like a line of just mixes with all natural ingredients that make it easier so you don't have to like juice yourself.
Okay.
So there's all different ones. The line is called Your Super, and the creator had cancer at 24 and they were looking for ways to like get his system back together. So I cleared it with my doctor, but the gut feeling one, I take it first thing in the morning, and it really helps because everything on the list of what I should not eat for having diarrhea is everything that I love to eat. So, like I hate cooked vegetables, and so that drink really, I notice, makes a difference, because if I don't take it, I'll notice I have stomach cramps and more issues. But it's not 100%, but it's definitely helps.
Wonderful.
Adrian, is it just once a day?
I take it once a day in the morning. It says you
Just
can
once a
take
day?
it a couple times a day, and it tastes really gross. So I just add lemon juice in it, and with the lemon juice, it's kind of like a refreshing like celery juice sort of.
Oh,
with
great.
the lemon
Okay.
juice, a
Yeah,
light
maybe we can
flavor.
look into that,
Yeah.
Erin.
Oh,
Mhm.
absolutely. Yeah. Because these are the kind of things that I share, number one, with our team. We're always sharing ideas. It's wonderful about having our nutrition team because we're sharing, I heard about this. Did you hear about that? But then we can take this to other participants that say, you know what? I chatted with someone else that's on Verzenio and she recommended this. I've done the research. It looks pretty great. If you can give it a try. So we love that stuff. I also love that Bethany mentioned abdominal lymphatic massage, right? For
All that.
constipation. So, we're really thinking outside of the box and really putting that, sort of whole combination, whole body approach to our GI health, because it is all related. I love that. Oh my gosh, this is so great. And you know what we'll also do, because we are recording this, Sue, are we able also to post the chat, because we're
Good.
getting
I was going to say
information.
that. Yeah, I know that Mary, I mean, boy, she gave us her whole regimen for 1 through day 9. So, I mean, what works for one doesn't, necessarily know if it's going to work for you, but it is nice to sort of have some options and hear what other people are using, and then you can get into your own routine.
Correct.
I love Sarah's, like all of those self-healing tools for so many reasons, Sarah, right? All these self-healing tools,
Oh my
but
gosh.
to be able to tap into them, and they're so easy. So we'll definitely post the chat, Erin, with with everything that you have as well, with the PDF files and the PowerPoints and the
Right.
recording.
Right. I must try Erin. Yeah. Yeah, this is really great stuff.
Have
Mary,
you ever heard of fasting? Do you see Mary?
I have. So, so there is some actual good data, Marianne, about calorie restriction before chemo. There was, I can send you the study that I have, looking at fasting before and how many calories. It is quite low going into chemo. It has shown to potentially be effective in limiting side effects as a result of chemo, preserving the health of your healthy cells, and making chemo more effective to the cancer cells. Again, always talk to your physician. I would not recommend fasting at all in a couple situations. Number one, if a person is diabetic, whether you're insulin resistant or not, because we are looking at your blood sugar, and fasting and blood sugar control you don't play well. Also, if a person has any history of an eating disorder or disordered eating, restriction of food in general should not be part of a person's approach to food in general, because that restriction can be a little triggering. So outside of that, if it's something that you're interested in, I would definitely say talk to your physician about it. I'm happy to share with you the research study that I have. I can email that to you. So you can look into it. And I see Kathleen has her hand up.
I saw that too. Go ahead, Kathleen.
Yeah.
You want to unmute yourself there?
I can ask you to unmute. There we go.
Yes, Kathleen with a K. Let me find her. Yeah, I got her.
I love that. Yeah.
Right.
Phyllis.
Go ahead, Kathleen. See if you can unmute there.
I think I was just gesturing. I'm good. They,
Are you good? Oh, okay, no problem. Erin, I saw Sandra Jacobson was asking if canned fruits are good for diarrhea. How about canned fruits? I don't know if she's thinking about like the juice that it's in, the nectar that it's in, but that may be
I guess it would depend on the fruit,
sure that.
right?
Yeah.
Yeah, it would depend on the fruit because you're really looking at bananas, apples. Yeah, it would depend on the fruit. I would lean, Sandra, I would lean to whole fruit. I think you get the biggest bang for that with whole fruit.
Okay.
Yep.
That's what Pat was saying. She was wondering too. She has pears on the counter and just wondering if she should eat them or discard them.
Yeah. Well, so here also, remember, let's go back to you have a diarrhea issue. Okay. So you could do a little bit of food journaling because remember, and I have talked to plenty of our participants again that have said, I have some diarrhea, but I still do okay with a little salad. I can do a little, if I go too big, then that's my problem. But if I have a little serving, I do okay. Right. So a little bit of learning there. So Pat, I would say, don't throw it out because we're not about food waste. Maybe we do a little bit of learning. If you have them, keep a journal nearby. If you find that in the next couple hours, you start to feel some GI distress, maybe we're putting that puzzle together. So
I know my diarrhea is totally because of the Verzenio I'm on.
Yeah.
Yeah.
Right.
Yeah.
Correct. So what we're trying to do.
Should I poach them maybe? I mean, I don't know what to do,
Mhm.
So there's a couple ways that you could do this. So you could look at the quantity that you're having. So if you want to have a raw pear, start with a half, right? And see how you do if you want to try raw. You could try peeling the skin off of it that's the most fibrous part of it and see if you do better having it without the skin. You could also try poaching it as well, because again, then we're going to soften that skin in general. So there's a couple ways that you could approach that. So you could look at portions, cooking it or removing the skin. And I'm glad that you brought that up because again, when we think of food and these GI symptoms, it's really about similar with Sarah, right? It's all about how we're managing those GI symptoms, right? We know that the pears aren't necessarily the issue. We know that Verzenio is causing that. What can we do so we don't aggravate it, so we don't bring it on, so we don't make it worse? These little tips or tricks that we could take away.
Erin, can you roast your fruit too? Because I know that's another way of just warming it. Roast it with olive oil. Is the olive oil going to interfere at all, or is that fine?
If it's a little bit of olive oil, if you wanted to, fine. If we're getting into something that's very heavily laden in olive oil, we're getting into high amounts of fat at a time, then we might be, it might be a little bit problematic for it, but I think a little bit would be just fine. And Pat, I see what you're saying. I've been eating all wrong. It's all about learning, right?
Yeah,
Don't be hard on
absolutely.
yourself. That's why we're here, right? To learn. You would not know these things. You would not know these things unless you learned or read or connected with us. So, not that I think you're beating yourself up, but it's okay.
No, I don't understand why my oncologist never gave me any of these tips.
I know it is that is why we are here. We bridge that gap, Pat, and then what you can do, we have 4 registered dietitians led by Erin on our team, and you have access to them all the time, like honestly, all the time. And they will make time to have an appointment with you one-on-one. Even if your passport is expired, they do not expire. They are always there, very, very ready to serve. And you can use them all the time. So please, if you feel like you're still conflicted, I can see in your face a little bit like you're like, shoot, how did I not know this? Get on a call with Erin or Michelle or Aubrey, and you can go over something that's really personalized to you.
Absolutely. Yep. So,
ascites, do you know that, Erin?
I do. Ascites, I do.
Ascites.
I do. Yeah. Marianne, you and I can connect individually about that. Because sodium really comes to mind with ascites in particular. And again, it's really about not having Actually, two things. So sodium aggravating fluid retention on top of what's already happening, the overall ascites that you're experiencing, and then overall fluid intake. So I'm not sure if you're on a fluid restriction with that, but you and I can definitely connect, Marianne. I'll email you, and we can talk about that for sure. And with that being said, I know
check on that broth.
way over, way over. I appreciate everybody hanging on. So I am going to turn it back to Sue. If anyone has any other questions also for Sarah, I'm going to jump back over to my kitchen so we can put that broth and then we'll wrap up. But I do appreciate everyone hanging on.
That's great. Yeah, let's check out that broth, Erin. I'm very curious. So I'll let you pop back over here. I am going to thank our sponsors once again while we're chatting. And I'm just so glad that the chat was so active, because it just allows us to continue to learn, to continue for us to learn as well, to bring you more tools and really hear what you're saying, and hear what you need. And that is what we're all here for, right? We're a full team. Erin, people have stayed on the entire time. It really was an active chat, an active conversation, and we will do more of these for sure. I am going to pop back over. I'm going to share with Erin. And while she's looking at her broth, getting her apron on, let's see how you're doing there, Erin.
Can you hear me okay?
I can, yeah.
Excellent. Oh, this looks great. Okay, so this is ready to go. This is mine that I started a while ago. So again, with this kind of thing, we want to, and I'll bring this over. This is just hot. Let this steep at least an hour. I usually like to do an hour and a half. I'll show you what this looks like. Everything is very, very soft and well cooked, right? So we have this beautiful broth. So let's serve a little bit. I'll show you what this looks like because it has a beautiful golden color. And then let's talk about what we are going to do with our very, very soft vegetables. I love this. Oh my gosh. This is like the most warming, soothing. Oh, it's so good. So now I would just sip on this. I honestly would put this in a little mug, just like I would tea, and I would sip on this. So we'll let this cool for a minute before I taste. With my vegetables, so in theory, I would strain this, right? I would strain my broth separately, and now I have all these really soft vegetables. And before you go, I'm just going to toss them. Here was a suggestion from one of our Unite for Her participants. Blend it. Take all of these really soft veggies, throw them in your blender and blend them down and add them to your ice cube tray. Let them cool, add them to your ice cube tray. When you make soups, when you make stews, when you make a smoothie, pop a couple of those ice cubes out. And now we've got all of these veggies and all of these goodies and fiber that we can add to anything all month long. And now we have no food waste, right? So we're going full circle. I love that. Right, Sue? I was like, yes, I love this suggestion. So that's what I would do.
I never thought of that, Erin. I love it.
Absolutely.
Yeah.
Blend, 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 blend. The whole thing. If you want to add a little bit of the broth to thin it and then just freeze it. And same thing you would do with like pesto over the summer. Pop a couple cubes out. Maybe you let them defrost. And now you've got all of these nutrients and it's a wonderful boost to absolutely anything that you're making. And then we're minimizing food waste. So that is what I will do with this batch,
Bring some into the office, Erin. We'll sip on it.
Oh my gosh, it's so good. It is. It's really, really good. And the broth does freeze well. So know that if you make a large batch, keep half of it in your refrigerator and then freeze the rest. And as you need it, maybe you're saving it for the weeks that you just received chemo and you find that this feels really good to your belly, then you can defrost it, but this is really good. So, and I did pop that link to the official recipe in our chat early on, but we'll make sure to include that with the video as well.
Yeah. Erin, do you know if bone broth, do you do this with bone broth as well?
You could do this with bone broth as well if you wanted to make some, and I know a lot of bone broth recipes may not always use veggies with it, but absolutely if you wanted to do that, and then you add some bones, you would strain those bones out first to make sure you're pulling those out, but you could keep those veggies and then blend them also.
Awesome. And then one last question, Erin, I know you had a fantastic PowerPoint as well. Could you pop that in the chat for our community? And I know we'll also have this up on our Her library. I'm hoping that all of you have that earmarked so you can get on there easily. And And we will do it again. We definitely, you know, we have a need for this and more of it. And I think we're constantly learning as well, so we can bring more to you.
Absolutely. So I will do exactly what Sarah did. I will print as a PDF to make sure that it's available, and it will go up on her library along with
Love
the
it.
video and her slides as well.
It's awesome. All right, Erin, I think you're going to take us off now. I thanks for staying on with us, everybody.
Oh my
I know there
gosh.
was quite a few people that said, of course, we're going to stay on. We're learning so much. I'm going to stay on with her. So Sarah and Erin, you did a fantastic job. We know that we wanted to have this as a topic. We were brainstorming, Erin, and just I'm so glad that, you know, we were able to get this in. Love the broth. And of course, in the Cancer Fighting Kitchen Cookbook, we have the mineral broth. That's another
Absolutely.
really fun recipe that you can do. When people don't know what to do for you, Erin and I, we say this all the time, tell them to make you broth, right?
Yes.
And then freeze it. People are looking to do things. This is an easy one. Take a photograph of that recipe, take a photograph of Erin's recipe, and take a freeze it. Yeah.
Absolutely. Yep. You can use it for anything. Yeah. So I appreciate everyone joining. Sarah, I appreciate your time. I'm glad that she was with us because I feel so strongly that, you know, when we think of our gut health, it's not just food, but our brain is so close. So I'm so thrilled that we have a fabulous expert on our Unite for Her team. Be sure to check out her tapping that starts tomorrow. smurphy@uniteforher.org is her email if you're interested. Also check out that virtual session that we did. I included the link from her library just to learn a little bit more. She is an absolute wealth of knowledge. I am privileged to work alongside her.
Yeah, so many tools, all right here at your fingertips, right? All right,
Absolutely.
everybody,
Build
happy
that tool.
Wednesday.
Happy Wednesday. Thanks for joining us. We also, one last plug. I forgot, so we have our speaker series tomorrow evening.
You do. We have a full week, Erin. Yeah.
We do. Lots of learning. I love it. So speaker series, Decolonizing Yoga, tomorrow evening, 6 p.m. Eastern time. You can go to our Facebook page. You can also go to our uniteforher.org under events. We have that there and register and learn more about yoga and then finish with a practice session. So lots of mindfulness this week.
Love it. Yeah, gosh, I remember, you know, when I did go through treatment, yoga helped me with my nausea, Erin. Yoga.
I know you said you swear by that. I know it. Yep.
Swore by it, but it was that chatter. It was all the skills that, you know, Sarah was teaching us and learning what was going to work for me. And it just works so beautifully. So I'm so glad that we have Michelle with us tomorrow. We're honored to bring all these different types of series to you. We're honored to showcase our team. They are incredible, extraordinary. And hopefully we're going to leave you with a lot of ideas and tools. And yeah, it's good.
That's it. Thank you.